Three-letter acronyms are everywhere in healthcare. EHR, EMR, DDS, RNA, HIM, the list goes on. As an HIM professional, you will become very familiar with two specific acronyms, EHR and EMR. In previous courses, you've learned about the electronic health record, or the EHR. You've also learned about the electronic medical record, or the EMR. As we explore the evolution of healthcare reimbursement, we'll be evaluating how these digital tools have directly impacted data management, healthcare documentation, and reimbursement. Accurate healthcare documentation is critical for patient safety and confidentiality in healthcare. Additionally, healthcare documentation is critical when it comes to reimbursement. Have you ever heard the saying, if it is not documented, it never happened? Well, essentially, this is the golden rule for the administrative side of health information management. A patient's medical file or record contains many different forms, documents, and sections that need to be accessible by different healthcare personnel throughout a patient's continuum of care. Before the dawn of the EHR or EMR systems, many items in a patient's record were mailed to different departments, offices, or facilities to share his or her medical and financial information. Can you imagine how much time and money went into communication alone when trying to share healthcare information and documentation via snail mail? The good news, healthcare technology and communication have really evolved. Not only has this digital evolution helped organize how information is shared, but these digital tools have also helped with compliance, helped save time spent on accessing and reviewing information, and have also helped secure monetary return. Being able to streamline the documentation and billing processes can lead to more efficient treatment and a more expedited outreach for reimbursement. Billing time is cut in half. Human error is greatly reduced, and the tracking of documentation is one click away. Let's take a look at some of the differences between an EHR and an EMR, and how they impact the reimbursement process. Let's take a look at our first three-lettered HIM acronym, the Electronic Health Record, or the EHR. The EHR is a comprehensive system that collects patient information, documents, and medical records in a type of one-stop shop. Depending on the medical facility, an EHR can easily transfer information between departments, providers, and treatment facilities based on a unique patient identifier or ID number. EHRs can provide a streamlined process for accessing patient information to better provide appropriate treatment and quality care. Some of the most important aspects of the EHR include its ability to provide access to complete and accurate patient health information and data, promote the coordination of patient care, allow access to patient-specific decision support tools like drug interaction reports, automate providers' observations, notes, and care plans to ensure all clinical information is communicated, prevent delays in healthcare response that help avoid gaps in treatment and care, and to support the collection of data for uses other than clinical care. Sure, the EHR is an incredibly helpful tool to organize patient information and medical documentation. But another huge focus of any EHR is for reimbursement purposes. The EHR collects data each time a patient is seen by a medical professional or receives medical treatment or care. One of the administrative applications within an EHR houses a patient's financial information, which keeps updated insurance documentation on file. This documentation allows for a type of digital paper trail to ensure billing is complete and reimbursement is efficient. An EHR not only organizes and stores information, but it also saves on time. The improved documentation and automated coding capabilities work together to create a more efficient practice. Now, Let's evaluate the purpose of our other three-lettered HIM acronym, the Electronic Medical Record, or the EMR. The EMR is a bit more specific. Its primary goal is to provide an organized flow of documentation within a single healthcare practice. This version of a digital patient record includes specific information such as medication and problem lists, clinical notes, and other related documentation. It also allows providers to prescribe medications and view results of lab work and other types of testing, as well as alert providers of any specific patient-related information. Electronic medical records aren't just used for documenting patient medical information. EMRs are often focused on medical practice management. Since this information is easily accessible by all providers within the practice, this makes billing and reimbursement easier to address for multiple settings. As we can see, EHR and EMR systems work hand in hand to provide an organized flow of documentation. This helps when billing for services rendered.